Good evening and welcome back to our weekly stats report. My name is Sara, epidemiologist with the Jefferson County Health Department, and tonight we are reviewing the week 37 COVID-19 data. For those who may be new here, we always like to include a full CDC week's worth of data in our reports. That CDC week always starts on a Sunday and ends on a Saturday, so our videos will always include data from the most recent full week. Today, our data includes the CDC Week 37, which began on September 6th and ran through September 12th. We release a few different reports each week, all of which are available on our website. Today, we're going to start off, as always, with a detailed review of the weekly COVID-19 surveillance report for the entire county. I'm also going to highlight some of the main pieces from our hospital systems report, our 0 to 19 age group report, and our report that excludes those long-term care facilities. Let's begin with the weekly total COVID-19 surveillance report, including our community-based cases as well as those long-term care facility cases. During week 37, we had a total of 340 confirmed and probable COVID-19 cases in Jefferson County. This brings our year-to-date total to 3,500 cases as of September 12th. We are reporting 52 COVID-19 associated deaths, as well as 18 outbreaks in the long-term care facilities. Outbreaks in those long-term care facilities are defined as one or more confirmed cases of COVID-19 in the residents or in the staff. Starting with Table 1, we are looking at the number of confirmed and probable cases by week. We are going to skip down to the bottom of the table where you can see the numbers from week 37, which began on 9/6/2020, that date that's listed in the second column there. Please remember that this is just the start date, and this data does include the entire week, which ended on September 12th, this past Saturday. And right away, you will probably have noticed that we saw a pretty good decrease this past week in our weekly case count. While this is definitely what we want to see, we don't necessarily want to assume anything quite yet. We may be experiencing some kind of holiday effect from Labor Day, possibly decreased testing demand or a delayed data reporting, but the data will likely stabilize in a few weeks, and that will really tell us if we are truly headed for a downward trend, or if, like I said, this may have just been a little after effect from the holiday. This particular table includes our lab confirmed and probable cases. So one of the questions that we often get is, why do we include those probable cases? Well, the lab confirmed cases include those individuals who receive a positive result from a diagnostic test. Those probable cases include the individuals who have met two very specific criteria. So one, they were a direct contact of a positive case, meaning that they were within that 6-foot distance for 15 minutes or more of that positive case. And two, they have become symptomatic since they were in contact with that positive case. So we include the probables in our case count because the likelihood that that probable case has COVID-19 is very high. They have a direct link to a positive case, and they are actively ill, but they may just be waiting on a test result, or they may not have even been tested yet. If you would like to know how many of those cases are lab confirmed and how many are probable, refer to those graphics with the bubbles on our Facebook page and on our website because it is listed there. For those who want the data excluding those probable cases, we do have a graph that I'll be showing in just a bit that only includes the PCR lab confirmed cases. In Figure 1, we see the confirmed and probable cases by week in bar graph form, which helps to show how our weekly case count is moving. On the right-hand side there, you will see our weekly case count sitting there at 340. We have seen weeks where our case count has dropped from the week before and then went back up the week after. So in order to make sure that this weekly case count continues to go down, we still need the help from everyone in the community. I'm sure everyone would love to see this weekly case count continue to drop, so let's make sure we are all doing our part to ensure that this can happen. Please use caution when you are out in public, so wear those masks. Try your best to stay 6 feet away from others and just continue practicing good hand hygiene overall. The next chart shows a breakdown of the daily case numbers and the 7-day rolling average of cases. The dotted line is the number of daily new cases, which, as you can see, fluctuates from day to day. That solid blue line is the 7-day average, which helps to smooth out those fluctuations in the data. Even our 7-day rolling average sometimes looks a little jagged, but what we're looking for is to make sure that that solid blue line continues to move downward overall. It does appear as if the 7-day rolling average of daily cases is trending downward just a little at the end, right there from 9/6 to 9/12, but it will definitely take us a few weeks to really know if this decrease was just a small blip from the holidays or if it truly is the direction that our data is flowing. This 7-day rolling average of cases is one of the main indicators that is used for that color guidance chart for our county. Based on our numbers for this past week, we have moved back down into the orange status, which is certainly good news. Next, let's look at the overall age group data in Figure 4. The 20 to 29 year age group still has the highest number of cases with 613. The 80 plus age group still has the highest rate per 10,000. Most of our groups saw a decrease in cases compared to the number that they had in week 36, as indicated by our overall decrease in cases for the week. In Figure 5, we will be looking at the fatalities and the fatality rate by age group. There are now 52 reported deaths in our county, most of which have been in our 80 plus age group. 12 of these deaths have been in the general community, and the rest were members of the long-term care facility community. Our cumulative fatality rate of 1.49% in Jefferson County is still lower than both Missouri and the US. Missouri's fatality rate is 1.66%, and the United States has a rate of 2.99%. I'd like to give a short weekly reminder that COVID-19 is a preventable virus, and if we all do our part to slow down that spread in our community, we can prevent some of the hospitalizations and some of those deaths. Just because Jefferson County does not have a toddler death to report doesn't mean it can't happen. We certainly do not ever want to report a fatality in one of our younger age groups, just as much as we don't want to continue reporting increased deaths in our older age groups. No matter the age, they are still a loved one of someone in our community. Moving on to Figure 7, we have the COVID-19 PCR test results by week, as well as a nice visual of that % positive rate. This data only includes those lab confirmed cases, so the number will look different from our main weekly case count because it does not include those probables. That dark blue dashed line is our % positive, and as you can see, even with the slight drop in cases, the % positive is holding steady there right around 11%. Let's break these numbers down in Table 3 where we can see the actual values of those positive and negative test numbers. In week 37, we had 320 lab confirmed positive cases. When we are counting those positive tests, we never include duplicates in this total. We have staff who follow strict processes to make sure that even if a duplicate lab report does come to us, that none of these are ever counted twice in our overall count. This count also does not include those probable cases. Our % positive for week 37 is currently 11%. As many of you know, this % positive tends to stabilize after a couple weeks because we do continue to get negative reports well after this report is published. We rely on the state to process and report those negative test numbers to us, and there's often a 3 to 4 day reporting delay. It is not uncommon to see that percent positive change for the previous week or two until all the lab reports come through to us. We always keep these numbers as updated as possible, so small fluctuations in that data should be expected as more reports come in. Moving on to Table 4, the COVID-19 cases are divided up by race and rate per 10,000 residents. The white population in the community still has the highest number of cases with 2,744, as well as the highest rate per 10,000. As a reminder, we do not include any missing or unknown race data when we are calculating these rates. For the zip code data this week, we can see the cumulative number of cases in each area shown in blue, as well as the active cases in each area shown in orange. The active cases are those new and recent cases that are currently under investigation and are in the process of completing their isolation period. Our Arnold area, 63010, still has the highest number of cumulative cases as well as active cases in the community. They currently have 184 active cases and a cumulative total of 614 cases overall. But a few other areas do have a high number of cases right here at the moment. Those cases are 63020 DeSoto, 63028 Festus, and 63052 Imperial. And you can see each individual number of active cases listed there in orange. And for those who may want to look into that zip code data in more detail, this graph, along with our zip code data per 10,000 residents, can be found on the last page of our weekly surveillance report on the website, jeffcohealth.org. As we look at the cases by zip code per 10,000 residents, things look much more even across all areas in this graph. So the rate per 10,000 takes the population of each individual zip code into account. So this helps to give a fairer comparison among some of those areas that may have higher populations or some of those areas that have smaller populations. And as you can tell, many of our areas do have a very similar rate per 10,000. Currently, the Festus area, 63028, has the highest rate per 10,000, followed by Crystal City, 63019, and Herculaneum, 63048. For our hospitalization data this week, we are once again going to take a look at the data we received directly from our local hospital systems. We are currently receiving information from BJC and Mercy facilities, and we are still actively working on receiving that data from SSM. So what this means is that the hospital system reports that you find on our website, as well as the data I'm about to present here, is not complete data. There are hospitalizations at those SSM facilities that we are aware of through our resident reported data that is not included on this report because we didn't get the information directly from that facility. This also means that there are possibly deaths in which we are aware of that occurred in the hospital, but aren't on this report as well. What is presented to you in this hospital report is meant to give you a snapshot of what is occurring in our community, but it certainly should not be used in any context that would imply that these are the only hospitalizations and the only hospital deaths that are happening in our community. As of week 37, a total of 258 COVID-19 associated hospitalizations have been reported from the hospital systems for Jefferson County. 36 of these patients have been admitted into the ICU, and 14 positive COVID-19 cases required ventilators. In Figure 2, we have the hospitalizations divided by age group. The hospitalizations that are counted here are going to include everything from an emergency room visit to those who are admitted as an inpatient. Each one of our age groups has experienced at least one hospitalization. The highest number is still within our 70 to 79-year-olds with 54 hospitalizations. But as you can see, No one is necessarily exempt from experiencing severe symptoms or severe effects from the virus, so it is important to take precautions and focus on prevention methods as a way to keep yourself healthy and keep your loved ones healthy as well. Next, we will take a look at the length of hospital stay. We have had a cumulative total of 98 emergency room visits, which is a sign that those individuals have experienced severe enough symptoms that they felt the need to seek medical help. There are currently 25 Jefferson County residents who are still in the hospital at either BJC or Mercy facilities and are COVID-19 positive. This is an increase from our current inpatient count from week 36, which was 21. Most of our hospitalized residents remain in the hospital for about 1 to 2 days, but there is also a good amount of residents who have been staying longer than that as well. Next, I want to quickly touch upon the current school-aged population data. As of week 37, there have been 454 total lab confirmed and probable cases in the 0 to 19-year age group for Jefferson County. In figure 1, we see the number of confirmed and probable COVID-19 cases by week for the 0 to 19-year age group. During week 37, there were 65 cases reported in the 0 to 19-year age group, which is just slightly lower than the case count from last week. But this number is still pretty high compared to what we have seen in the past for this age group overall. Be sure to refer to the entire report on our website for more detailed information that breaks down the 7-day rolling average of each age-based grade level, as well as the zip code data. Lastly, we will quickly review the weekly community-based surveillance report, which excludes those long-term care facility cases. In figure 1, we see the weekly case count excluding the long-term care facility cases. During week 37, 311 of our cases were in the general community, meaning only 29 cases were found in the long-term care facilities. Those cases come from both the residents and the staff of those facilities. When we look at the age group data for our community-based cases, once again, that 20 to 29-year-old age group has the most cases with 575, and they also have the highest rate per 10,000, which you can see there below the case count. 3 areas stand out when we divide up our community-based cases by zip code: 63010 Arnold, 63028 Festus, and 63052 Imperial all have the highest amount of cases in the community, excluding the long-term care facilities. And that's it for today's stats. Please leave us any questions that you may have in the comments or reach out to us via direct message on our page. We hope you continue to have a safe and healthy rest of the week. Thank you for tuning into our weekly stats overview and have a great night.